Hello, my name is Tony Chin-Quee,
And I'm Frances Mei Harden.
and welcome to Social Rounds, the podcast in which two of the happiest surgeon dropouts you'll ever meet give our unsolicited opinions on the states of medicine, the world at large, pop culture, and whatever else we happen to find interesting. Personally, I do like when people ask me how I'm doing,
Oh shit.
because sometimes I have some thoughts.
How are
Yeah.
you?
Hey, Francis May. I'm great. And I learned something about myself and my body this week because I was recently traveling to America and it was like long travel days. I had like three planes, 16 hours. It was very long. And I've done that a couple times recently. And I realized that flying on a plane is no longer fun for me to do. I don't like it. I used to enjoy just the getaway
No.
of it. Now it just causes my body to hurt and nothing's comfortable. I realized the other day, like the seats are uncomfortable. I'm not flying business class up in here. I'm flying economy, maybe economy plus, you know, if I'm feeling saucy. And the seats are hard, man. And so I had to like invest in like a donut, like a seat cushion from my butt bones to like
No.
support the sit for like 8 hours straight. And I was just like, wow, okay. So, I'm sharing tactics with the elderly, and that's where I am in my life, and I have to accept that. Except on my way back to Europe, I was in a row of seated dudes, and I was like, I just stood up and like I had my seat pad on the seat, and dude next to me was like, "Hey man, I got one of those too." And I was like, "You kidding me?" And it's like a dude my age. He stands up, pulls his donut out, and shows me. And I was like, "You know what? I'm here for this brotherhood." And then across the aisle, this old lady starts like tapping her husband. He was like, "Hey, show him what you got." And then he pulls his donut out, and then just a little, you know, butt pain fraternity was had in economy class on the flight across the Atlantic, and so that's where I'm at. Hooray for me.
Yeah, you're talking a lot older than you are, and certainly
I
than you
know.
look.
I feel like I'm pulling off way younger than I actually am, and my body is way older than I think I actually am. Which it's this is called getting old, guys. This is how it feels.
The long haul flights are not easy. I have even personally experienced, like, pretty much once I turned 30, I could not fly without a compression sock.
Got
People
to do
have
the
asked me
squeeze on
before,
the calves. Yep.
yeah, like I won't recover. I'll just have, I might have venous insufficiency or something. I'm not sure, but I do not bounce back after a flight unless I have all my stuff just right. And I have one of those neck things because various cervical issues presented themselves, kind of like late residency, probably ergonomics related.
Mm-hmm.
Um, but yeah, I mean, mostly what I'm taking away from this is that we both need to win the lottery to get into like Delta 1 levels of comfort because I agree,
Look,
sitting in economy is
I
just not it.
it's not it anymore. And I'm looking at the folks, I walk past them with disdain when I can. Most of the time, they don't even let you board with them. You can't even see them when you board. You
Yeah,
have
they
a
go
separate,
left and you go
they go
right.
left. You get a separate door so
Yes.
you don't disturb the business class elite. And it's probably for the best because I would like look like longingly at them and just maybe with a little bit of judgment and just overt jealousy and rage, and they don't need that.
Yeah,
I
you'd
wouldn't
like
want to see
linger at
that
their
if I, yeah.
seat, cause boarding delays. Yeah, no.
Yeah, I would just
That's why
stand there
we
and just
have to
be
go
like,
right.
"Hey, how's the support? How's the support in that seat? It's good because it looks good from here." And I would just make everybody uncomfortable.
Well,
And
and
they
you'd
don't
have
need that.
like your butt donut would be like hanging off the suitcase, like banging into people rolling down the aisle, I presume.
It is no, it's unwieldy. It is very difficult to to either hold onto or put into a bag. It's very springy. Anyway, let's get to it. Actually, in really good news, this is where we give our rapid fire takes on recent inside baseball news, outside baseball news, and whatever else we happen to find interesting. And today, for inside baseball news, we're diving into major news. which I love, surrounding postpartum depression. So, first off, let's talk about postpartum depression and why it comes about. So, essentially, for the 9 months of pregnancy, the hormones, estradiol and progesterone, slowly rise right up to the moment of childbirth, at which point estradiol can be like 200 times your normal non pregnant baseline level, and progesterone can be about 20 times or up to 20 times the baseline. So these hormones are at massive levels in the body. And then as soon as the baby's born, those hormones completely crash down to the baseline over the course of just a few days. So you can imagine that has some effects. And one of the most common effects of the hormonal shift is what they call baby blues. It affects about 80% of mothers. It's a relatively mild period of mood swings, crying spells, and anxiety. It usually resolves after the first couple of weeks, but it's when I say mood swings and crying, like it doesn't feel mild when you're going through it. It definitely feels like you're going nuts, but it doesn't last too long. But for some women, the change in mood is far more severe and it lasts for way longer. And that's postpartum depression. And in addition to the common symptoms of depression, it can also include powerful waves of anxiety, panic attacks, and really powerful and scary, intrusive thoughts, like often having to do with the baby's safety. So it's really devastating. And it's really common. 1 in 8 women report symptoms of postpartum depression, and it's estimated that many more suffer in silence and are never treated. Because as advanced and progressive as we like to think of ourselves as a society, it very rarely feels safe for women to share this experience with anybody. Like, because they're having worries like, what if I share this and they think I'm a bad mom? Or what if they try to take away my baby? Like, those worries are real and terrifying, and it keeps people being depressed by themselves. But help is on the way because there's a new blood test on the horizon called MyLuma that can be taken during pregnancy and predict a woman's risk of developing postpartum depression with over 80% accuracy. And how? How does it do it? Well, it's through what we call epigenetic changes. These changes in the hormone levels during pregnancy actually leave little footprints on our DNA. And in women who are vulnerable to postpartum depression, there's a very specific footprint pattern, and the test can recognize it. So, as you can imagine, this is going to lead to proactive, preventative mental health care. So you won't have to wait until you're trapped in the fog of depression to actually get treatment. And also, hopefully, this can break the stigma around postpartum depression. So it's proof that this is not all in your head, it's not a personal failing. Postpartum depression is a biological event, just like every other disease process, and can and should be treated as such. So, Frances May, I thought this was a really great opportunity. I love this story. I'm so happy that this sort of stuff is on the way for women going through pregnancy and coming out the other side. But I thought it was a really great opportunity to talk about stigma, which we've heard many times over the course of our lives, and what it means and how it can be weaponized. What it means and how it can be weaponized, excuse me. So, just to define stigma, stigma is a mark of disgrace associated with a particular circumstance, quality, or person. So, in your life, particularly your medical life, okay, what's your experience been as regards stigmatized behaviors and states of mind and personality traits? Like, how have you experienced it?
Yeah, for sure. Well, and first I want to thank you, and shout out. This is why Tony's Corner is important because if somebody had like in a pimp style asked me what was causing postpartum depression, I did not even really know that it was certainly not that level of detail of the hormonal changes, but I just feel like it also doesn't sound crazy to me to just say the baby keeps you up very frequently. Like that alone would make a person go slightly off the rails,
Hmm.
having experienced that on like junior
Yeah, this
call.
is
And
this is
so
all on top. Yeah, hormone stuff on top of like your life.
so in terms of stigma, I think that like absolutely in medical education, this issue of any perceived weakness, there's a stigma associated with that and it can be weaponized against you. That to me is part of like the crux of the problem because literally you can insert anything in there, anything that could be
Hmm.
perceived as weakness. Weakness is like a very big bucket for such a judgmental group of people. So literally it could be like that you dyed your hair a funny color. They'd be like, oh, perfect, because that makes you look a little unprofessional. And now, like, and also maybe mentally ill, because like, who would dye it that color? Like, I really think that
Hmm.
the options are endless for what people will try to stigmatize or use against you. Now, after having gone through it and grown up in it, I really have just, I embrace a whole other set of ethos, which is like, number one, I don't get embarrassed. Shiv
Good,
Roy
good
from
for you.
Succession kind of taught me that. Like seriously, I would say like my tolerance for what people would call embarrassment, humiliation is like quite high. Like I share a lot of my life and stories about myself where people are like, you could not waterboard that out of me, right?
Hmm.
And I get that, but it doesn't embarrass me. I feel okay. I feel fine about where I'm coming from. I am trying to illustrate a point or tell a story. And like, I think that the reason that it resonates with anyone is because people see that and they see a person saying, like, whatever shame you're trying to like put on me about it, I don't accept. I do. This is why I really believe, like, the old quote I'm paraphrasing, like, shame dies in the sunlight. So I guess that to me, there's so many ways that we can stigmatize aspects of becoming a physician. We can stigmatize elements of the person, characteristics of the person who's going up through that process. I got diagnosed with adjustment disorder during residency. I think that somebody could stigmatize that. They'd say, well, if you were a tougher person, you wouldn't have experienced that during residency. But because I feel pretty good about my level of resilience and toughness, that is more a reflection of the environment, not just me. I actually
Hmm.
think if a lot of people walked in my shoes in that work environment, they would also get hit with an adjustment disorder and be at the doctor's office.
Well, let me ask you that. And first of all, thank you for sharing that. I think is important, and we're going to get to this a little bit later in the show too. I think we got some unified themes today, which I'm very pleased with. But you said that you are not quick to feel disgrace. Um, but how did that come about? Were you always like that, or did you have to go through some shit? And like, was there a moment where you were just like, "Oh, I'm not going to feel bad about this anymore"? Like, what changed?
Yeah, I for sure was not always like that. I was very, very thin skinned and like constantly embarrassed. And I feel like that ran a lot of my life for the first two-thirds of my life at least. I actually think that's a gift probably that residency gave me,
Mm,
residency and afterwards. Like, so no, I'd say over the past several years, I have just changed my relationship to this stuff. And honestly, and I hope people can reflect on this and see if it rings true for them as well. I just was humiliated and disgraced so many times and I thought the world would end and it never did, that like that is what made me tough. The other last thing I'll mention is that when I became an attending, I found a hypnotist in my area and the first thing that I asked them for was thicker skin. So like if
hmm.
that worked, then maybe also that worked.
So that worked for you? The hypnotist worked?
Well, oh,
I've never
yeah, for
been to a
sure.
hypnotist. I'm not familiar with their game.
Game is very strong. My whole ass book, Tony, coming out in February, it is really about my
Mark it on
experience
your
in
calendars.
hypnosis. Yeah. It's
Excellent.
about my experience in hypnosis, like as an attending, kind of dealing with
Yeah.
the complex PTSD and everything. So
Oh, hell
yeah,
yeah.
hypnosis does work, but I really think that like everyone in medicine, we're such evidence-based people, and I'm just saying you get to a point where you're old enough in life and like mature enough to look at all the evidence. Like I know for a fact embarrassment and disgrace does not kill me because I really think I've felt it turned up to the max, 200%, many times,
If it was going to
and it
kill you,
didn't.
it would have done it.
Yeah.
And it did not. You remained. That's awesome. I mean, I think when I think about, stigma and why this another reason why this story sticks with me. I mean, I live with major depression. I've had it probably for most of my life. Was really only diagnosed, in early adulthood. And I avoided getting treatment, you know, just like I think most folks do. Most, high performing folks try to, or anybody tries to, because yeah, you don't think of your mental health as biologically based. You think of it as mental. You just like, your intelligence is mental, your emotions are mental. And so, you know, you think that you can be smart enough to think your way around it and through it, is what I found. And so I would try. That was kind of like the way I gritted my teeth through most of my early adulthood, is just like, I have these feelings of, hopelessness. I have these feelings of, I don't want to get out of the bed. It feels distinctly different than I felt 2 months ago, but maybe it's just because, that's where I'm at, but I'm sure I'll be able to figure it out. Until, I realized, like, hey, my brain can't figure this out. And that was the other trouble with going into medicine, was, not only did I think I was too smart for my mental illness, but uh, I thought the more I learned about the biology of mental illness, like, you would think that I would get it, and I would allow myself to have these diagnoses and be proactive about them, and it only made me uh, swing in the opposite direction. That uh, that sort of personal stigma that I was living with, in addition to the professional stigma of, yeah, you guys got to be, you can't be weak. This is a weakness. If anyone finds out, I mean, for those not in medicine, I don't know if they still do this, but I'm pretty sure they might, but they've done it for a long time. Like, when you get out of residency and you're trying to get licensed in a state, they ask you on that licensing application, hey, do you have any mental illnesses or anything that we should be aware of? Like, the implication being that if you have any mental health struggles, that you may not be fit to do your job as a doctor. And did I sign that I like had depression? Absolutely not. Even though I totally did. And if they really wanted to know, they could look me up and see what my medications were. I'm not going to tell them, because it's you being used as this tool to kind of weed you out, make you feel like you can't do your job if you have these very human things going on, which I think is bullshit. And so, there's a lot of stuff, I guess, stigma wise, that I've battled, and I think a lot of other folks battle. It's not great, but it's very real. And so I'm really glad when anything can come about that helps pull us out of that stigmatized world.
I love that. Thank you for sharing. And I really do. Like, I mean, I believe a lot in the power of, yeah, maybe I'm biased. I think Tony is a really cool, brilliant guy. And when we
Very
have
cool,
role
guys. Listen
models,
to Frances May.
yeah,
Total role model.
he had to Venmo me to say that today. But I still
Money
said it,
well
and I
spent,
still
guys.
I'm
So
I'm
well spent.
entitled to my monies. But no, I'm just kidding, because genuinely, like, when you have people that you respect, that you know that they're cool, they're so intelligent, and then they are willing to, like, name their experience or say, okay, well, major depression is part of my life and my diagnosis list. I mean, I don't think that there's like a stronger destigmatization than that, because I when like and I love, like, I feel like in society and pop culture, even the past few years, like, we see more of that than we did certainly in the 90s when we were growing up and
It's
looking
encouraging. Yeah.
towards our role models. I do want to mention, I just want to call out the Dr. Lorna Breen Heroes Foundation. They have done a lot of incredible work at going state by state to remove that language from the licensing questions.
I had a feel
So,
I hadn't caught up with that, but I knew it was getting pulled, at least
well,
slowly.
exactly. I mean, it's state by state. Like, shout out, there were some early adopter states, stuff like that, and
Hmm.
they're moving through. But I will share that, like, love to see progress in that arena, because back when you would have been licensing for the first time, like, I that had not started. This is
Yeah.
more in a post-COVID world. um yeah, I think that that's the case, but also I have been a reference and, completed licensing forms for colleagues of mine, and especially when they are like smaller rural hospitals. kind of outside of major cities, it straight up asks me. I'm just, vouching for a colleague or someone I've operated with, and it will say, like, do you know of them ever having any mental health issues or concerns? Some of the questions will be, do you personally have any concerns about this person's mental health? Which I mean, that's, obviously doctors try to ask people who they have good relationships with, like you wouldn't want someone to flag you on that, but I'm sure that it happens.
I think that's bullshit, and that they should not do that. I don't think that asking someone else's opinion
Yeah,
on the diagnosable mental health of someone else, who they only know professionally, is fair in any way, especially in our neurotic fucking profession.
I
Like,
know.
that's just grounds to, yeah, you could torpedo somebody just because you thought they were a little weird, or
Yeah,
they
yeah.
didn't
Or they were
quite
like
live up to your
crying.
expectations in some way, or you saw them crying sometime.
Yeah, you saw
Yeah,
them cry at work
fuck you.
once, like a year
Yeah,
ago,
don't
and
do
you'd be
that.
like, yeah, I
Don't
do
do
have some
that.
concerns about their mental
Yeah,
health.
that's not helping the cause, medical profession. If you're listening, I think that's bullshit. Remember, I said it. But I think we're starting to do better, which is, all we can ask. Um, anyway, we're gonna move on to fun outside baseball news. And honestly, I'm thinking of just renaming outside baseball um, the what wild shit is going on in Kentucky segment, because we're returning to the Kentuck today. So here's the story. A couple of weeks ago, a woman in Kentucky was expecting a package to be delivered to her home, and when the package arrived, she opened it as one normally opens packages, expecting to find the things that she had ordered. But in this case, it was supposed to be, medication and medical supplies. But this package did not hold those things. She opened up the box to find not one, not two, but several severed arms and fingers just in a box. Now, I assume she responded with the requisite, terror and nausea and vomiting, but she wasn't interviewed for the news story, so I have no idea what she said. It was the police who were interviewed, and the police told the reporter that she had mistakenly received a box that had been meant to be delivered elsewhere for surgical training. So, well, all's well that ends well. The arm parts were retrieved the next day, and she received her medications shortly thereafter. But I have several questions about this story. First of all, Frances May, was this box meant for surgical training? What do you think? Have you ever heard of such like some such packages being delivered to any labs that you ever worked in, or that your colleagues worked in?
Yeah, I mean, it's giving Devil in the White City. It's giving serial killer. Like I
Um, I'm not like a big conspiracy guy, but this sounds like Conspiracy Town to me.
Yeah, I just like honestly, and we aren't plastics, I guess, but like what would you even do with all those fingers? I don't know. That just like doesn't really sound like anything.
It doesn't compute. This sounds like
Like what?
like I don't know what this cop is mixed up in that would make him say something like this. But this is clearly the package that you send to someone to make
With
sure they
their
don't testify in court about the stuff that you do. Like, this is
yeah,
someone's family member's fingers and arms that got delivered to the wrong house, right?
it feels like a wrong house delivery. I mean, because certainly in my experience, like cadaver labs are, I mean, was it not Harvard that had that big cadaver lab scandal in the past year?
I don't
Pretty
know what
sure
that
it was.
scandal. What was that scandal?
It was like that a director was like selling off body parts.
Damn.
Um,
See,
yeah.
we supposed to. I remember.
Oh, it
Didn't we
was. It was the
have
Harvard morgue case. Yeah. So
what was he?
his name
What was he
was
selling? Which parts? Do you remember?
I think all
All of
parts,
them.
if I remember. No, literally, remove body parts, including heads, brains, skin, and bones from cadaver after being used for study, but before scheduled cremation. So I think that
Uh
that's
huh.
how it was happening, and then selling them to various buyers online through social media. So we're
Look,
living in the bad place.
Yeah, no, this is the bad place. And here's my experience with parts, right? Like in anatomy lab in med school, you get the whole cadaver. You have this whole thing. I
Yeah.
don't know if you guys had this ceremony. We had a ceremony at the
Yeah.
beginning, like appreciating the donation, these lives that were, donated to
Yeah.
science so that we
Yeah.
could learn, right? So we do our thing. Move on to residency. We were in, ENT labs. We like dissected temporal bones.
Hmm.
So that's a chunk of the skull that was removed and donated to us, presumably after, a med school had used it and like used up all the other parts. If you are studying, like, let's say it's plastic surgeons, hand surgeons, or something, you're studying surgery of the hand. Um, I could understand, like having an anatomy lab with just a full arm, but I could not think of any reason to only have a finger,
That's
a,
what I'm
a
saying.
disembodied a finger unconnected to anything. Like if I'm trying to learn like how to connect arteries, like how to put these, bones together, like all that sort of stuff, I need a hand. I can't do anything with a thumb
I
unless
agree
I'm
with
trying to
you.
send a message.
Yeah. Yeah, unless you're trying to menace someone. Like, yeah, it
Yes.
literally is. Like, what can one do with just a finger? It is atypical because I agree with you. Like, we used to harvest our own
Atypical is the nicest
T-bones.
way we can think to describe this story.
Aberrant.
Atypical.
Yeah, atypical, definitely fishy. Like, I just agree with you because I don't know what lesson um what lesson starts there. I mean, maybe even the smallest subunit that makes anatomical sense to me might be like at the wrist. Like, sure, I mean, I definitely, I guess I
Maybe
would
at the
believe,
wrist, guys.
maybe, but this poor lady, because she's just trying to get her meds. I
You know
read
what
the
I'm
story, and
saying?
it was literally just like her time sensitive medications were being mailed to her. It's
I
like
was
that's
like
brutal.
praying. I was praying she was like a medical professional. Like some sort of medical professional who would open a box, be like, oh, there's hands. I freak out, but maybe I can continue to live a normal life and not be scared that every package I get for the rest of my life will be filled with parts. But odds are it wasn't. Odds are it was just some lady who need who needed like I don't
Somebody's
know, like
grandma out here, like
someone's
legitimately check on
grandma.
your grandmas.
What check your family guy. Like this is happening. And I honestly I thank Kentucky for sounding the alarm. Who knows how far reaching this stuff is going. Like people got to be on the lookout. But anyway, we're going to move on from that great story into social runs.
Yes, our last segment, social rounds. This is where we become your life attendings. It's abundantly clear that many of you are in desperate need of guidance, and we have the kind of wisdom that only comes from running out of fucks.
We're all out of them, guys. And the question this week is how do we deal with failure? So, in medicine, we got a lot of type A perfectionists, like people for whom success is woven into their identities. So, when the opposite of success happens, it can fracture your self image in ways that are often unexpected and can be like completely devastating. So, what I've learned along the way is that one of the best ways to navigate failure is by talking about it and normalizing it, realizing that it happens to everybody all across the spectrum. And not just talking about failures that end in super rosy, fashion for you and everyone involved. I'm talking about like the ones where like the negative feelings of failure follow you and haunt you for a long time. And we got to normalize that as well. Cause like what made me think about this, Frances May, is I just went to this conference and I went to this talk where they were talking about how we navigate failure in medicine and listening. People started sharing these stories. And as I was listening to them, I was like, oh, these aren't real failures, guys. Like this is like, oh man, someone
My
passed
article
out in
didn't
my
get accepted.
right. Like, or even like I understand how they felt to them like failures and like the sky was falling, but it wasn't like this seasoned doctor shared this story and admittedly it was traumatizing for him, but he was a resident, he was in clinic, someone went down in the clinic outside of his room. There was like he was early on in residency. He ran over, didn't know what to do. Someone got the Narcan. He was fumbling in the Narcan. It didn't he couldn't get it in, and the attending came in and did it for him, and he felt like a failure. Um, and then, later on that day or a couple days later, somebody reached out to him and kind of told him, like, "Hey, man, it happens to all of us." Um, but for this guy, like, this was a very formative failure experience. And I was listening, I was like, wow, like, we as a community, and this was like revolutionary for people to be in a room. There were like 300 people in this room, like sharing story. We even like turned to each other, started telling stories to each other. And I was like, wow, like as a community, we still we really don't know how to do this. Like, we don't really understand what vulnerability is. Like, if that's the extent of the vulnerability that we can share, then and we don't even realize that we're barely scratching the surface, then we're not yet doing the service we want to do. You know what I'm saying? And so I thought that we could share some stories about like real failure, um, had with some real shame, associated with it. Because like I think that, if any podcast is gonna do it, it's probably us.
Yeah, I that's so interesting. I think that physicians in particular, people in medicine, they have some of the least perspective out of any people that I've ever met across industries. And they also kind of want to humble brag the most and be defensive and kind of come out and, yes, share a story of like, what are my weaknesses? That I work too hard, that I care too much, that I never take breaks. And then, like, I guess with that guy's story, I'm just interested in, I wonder what's the distinction between feeling like a failure and having actually failed. Because I
Right.
respect, I
Right.
validate that man is saying, I felt like a failure when
He
this
felt,
happened.
yeah,
He,
and I'm not trying to hate on that guy or his story. Like, I totally understand. But yeah, I think exactly what you said. He felt like a failure, even though he didn't fail at anything therein. And so what
yeah, had
happens if
like,
he really failed?
well, that's what I'm saying. Exactly. He had what like he's describing a age and level appropriate learning experience. Like kind of
Yeah,
just it sounds like it was a normal stop on the way to mastery. I think that
exactly.
in medicine, medical education, there's something called the expert's illusion. That's not helping us. That's when somebody reaches expert level and they totally forget what it was like to ever not know this thing. So,
Hmm.
because the more that we normalize the regular learning process, like, hey, this will actually probably happen to like a lot of junior residents. A lot of these things are normal for junior residents. I do feel like, especially in my experience, it was a lot of how do you not know this yet? And it didn't matter if you were an intern or three or five, it was always like, how do you not know this yet? I had somebody scream that at me when I was a fourth year medical student. They said, how do you not? And it was something about like, the cribiform area. It was like a fairly obscure skull based question, and when I didn't know, they were literally yelling at me like, "How do you expect to apply an ENT when you don't even know this?"
Mm.
And I was like, "But you literally break down what they said. I guess knowing all of ENT is not a prerequisite to applying an ENT." Would be my answer after all
Mm.
this time.
Well, okay. Before we go today, I'll share my failure story. This is what I shared after I spoke with someone at this conference. I spoke with a fourth year med student, who shared a very similar kind of failure story to what the doc earlier told me. It was like a very age appropriate tiny mistake for which she felt the sky was falling, and I was like, oh, sweetie, it gets so much worse. And so I was like, all right, well, and this is a story like I I didn't feel I could share with anybody until like well after residency, right? And like I wrote about it in my book, but so anyway, like I said, like I have depression, I get depressed, I've had a couple of major episodes in my life. And one of those episodes happened towards the end of medical school. It was like fourth year of medical school, right? And um, it was precipitated by a relationship kind of falling apart, and I was the kind of person who always like even if I ended the relationship, I would take it really hard and blame myself, and then that would cause me to spiral and it's super healthy. Um, but I was really in it, and I stopped getting out of my bed. I stopped going to my rotation that I was supposed to be going to, like pediatric surgery. It's a pretty easy rotation in fourth year. You just kind of show up. It's really all you have to do, and I just didn't show up for like 2 weeks, and no one really knew where I was, and um, and I didn't care. I was that's where my brain was, and it was really hard. And after that month had passed, and I like finally, I managed to get my medications and all that stuff. I found out that I had failed the rotation, and because I had failed the rotation, I could not graduate until I had passed the rotation. And the only time I could pass the rotation was after my year was done, which meant after graduation, which meant, I was going to have to stay at medical school for a month after all of my friends who were graduating. And so I, they let me walk the stage um, for graduation with a big folder, just like everyone has, that has your diploma inside, except my folder was empty. And I took pictures and met with people and blah, blah, blah with an empty folder the entire day. Um, you know, didn't tell my friends, didn't tell my family, just felt like this fraud and just all this shame. Um, and then, tried to lay low until my friends left, and didn't tell anyone that I was going to the hospital to do this stupid rotation for the next month. And then when I started that rotation, I was doing it with, med students who were now fourth years. They were coming up behind me, and then they knew that I'd fucked up, and I felt like an idiot, around them. And then eventually, like, I did it as soon as as soon as I finished the rotation, I, packed up my house and I moved to Detroit. Um, but, and then I never talked about it again. Never talked about it in Detroit because I didn't have to. But it's just, I didn't feel like I could talk about it until well after training ended, because it was an actual failure, tied in with, you know, personal feelings of failure around my mental health, and, about my, ability to take care of myself, my intelligence, all that sort of stuff. Um, and, once I got out, um, I really, you know, realized that, hey, just I know part of the trick of depression is it makes you feel like you're the only person who could be feeling this terribly all the time. And that's part of the trick of medicine too, is making you feel like you're alone in your anxieties. But, I figured by the time I was done, like I can't have been the only one to go through some shit like this. I can't have been the only one to fail a rotation or fail a test or like, get held back or, XYZ. Um, and it happens to the best of us, and we can still go on to do great things, be great people. It's not an indictment on who we are, what we can accomplish. Um, and so that's the story I told to this fourth year student who's applying to
I was gonna
residency.
say, did you give
Yeah,
him a heart attack?
I was just like, I may have just scared her off of, everything. Um, but I think it's important to hear, you know what I mean? And important to demonstrate to each other, that when we're talking about vulnerability, you got to mean it. You know what I mean? Even if you're not quite sure where to start. I'm sure you mean it when you say like, yeah, I failed at this, meaning, yeah, I didn't do as well as I could have. But sometimes it just doesn't work out. Um, and you sit with it, and it feels icky and terrible, for any variety of reasons. And it takes a while, and you got to learn from it. And it takes a while. You don't learn from it immediately. Can take months, it could take years, but that's the trick of it,
Yeah.
you
I
know?
really appreciate you sharing that, your experience. Like I agree, kind of like by definition, yeah, that's a capital F failure. and I have had my fair share. I know we don't have time to really like go into it today. There's endless time for us to talk about the myriad of ways in which I have capital F failed. But I do just want to emphasize like failure is also a gift. I personally, I know we talk about I'm like a reformed gunner, and I never knew how to, never believed in like giving myself grace or other people grace until I had really experienced, like on the calamitous level, failure.
Hmm.
And I feel like that's true though for a lot of people in medicine. Like I guess, I look upon all the people out there who are like, yeah, these people sharing their weaknesses, they're just weak. They're just losers. And they're
Yeah.
like happy as a clam, and I get it. Like I was that person in my early 20s. I guess, I'd say best wishes to you. And for a lot of physicians, what I found is the second that something happens to them, then their whole tune changes. But it's wild how much there's this cognitive dissonance where until it happens to you, you're like, I'm just better than better than all of
Yeah.
it. And yeah, I see stuff is happening to other people. It's because they're not as good as me. And I
Hmm.
definitely do not believe that to be the case.
Yes. Nor do I. And we hope that you guys, whether you're in medicine or not in medicine, that it doesn't have to happen to you, that you can recognize the humanity in everybody around you, um, and just not be a dick about it. And with that, um, another successful and legendary episode of Social Rounds comes to a close.
If you enjoyed the episode, please subscribe, rate us 5 stars, leave us a review, and check out our website, hippocratic-collective.com, for more shows and content like this. Thanks for tuning in, and we'll see you next week.
Bye.